Hi everyone, in this video we'll discuss medicine chapter guidelines with practice questions. The most important topics covered in this video will be coronary therapeutic services and procedures, that is PCI, cardiac catheterization and hydration. These topics are very important for your CPC exam. So let's begin. Keep your CPT book ready, highlight important guidelines and codes and also take notes. First, let us start with coronary therapeutic services and procedures, that is PCI, percutaneous coronary intervention. This section is present in your CPT book, page number 778, Medicine Cardiovascular. The code from 92920 till 92944 describe percutaneous revascularization services performed for occlusive disease of the coronary vessels. That is major coronary arteries, coronary artery branches or coronary bypass grafts. To understand this, first let us know what are the major coronary arteries. The major coronary arteries are left anterior descending, left circumflex, right coronary, left main and ramus intermedius. In your CPT book, page number 779, they have mentioned the names of all these coronary arteries. So there are 5 major coronary arteries. Now it is also important to know the major coronary artery branches. These are the coronary arteries and these are the coronary artery branches. So from left anterior descending, you have branches, that is 2 diagonals. Then from left circumflex artery, you have 2 marginal branches. Then from right coronary, you have posterior descending and posterolaterals. And from the left main artery, there is no branch, and from ramus intermedius also there is no branch. This is mentioned in your CPT book. Please highlight it. So LD, LC, RC, LM, RI are the HCPCS modifiers for the respective coronary arteries. LD for left anterior descending, LC for left circumflex. Likewise, you have other modifiers for these coronary arteries. Now let us check these PCI codes. Check the code 92920, which is for percutaneous transluminal coronary angioplasty. This is for coronary angioplasty, single major coronary artery. Then you have the code 92921 for each additional branch. Then you can see the parenthetical note. Use 92921 in conjunction with 92920, 92924, 92928, 92933, 92937, 92941 and 92943. Highlight all this. Next you have the code 92924, which is for percutaneous transluminal coronary arthrectomy. So this is for coronary arthrectomy with coronary angioplasty when performed. This is for single major coronary artery. Then you have the add-on code 92925 for each additional branch of major coronary artery. Then read the parenthetical note and highlight it. Use 92925 with these codes. Then you have the code 92928, which is for percutaneous transcatheter placement of intracoronary stent with coronary angioplasty. Then 92929, which is for each additional branch. Then 92933 for percutaneous transluminal coronary arthrectomy. Highlight the term coronary arthrectomy with intracoronary stent with coronary angioplasty when performed. This is for single major coronary artery, and 92934 is for each additional branch. Then 92937, which is for percutaneous transluminal revascularization of or through coronary artery bypass graft. And here any combination of intracoronary stent, arthrectomy and angioplasty. Then you have the add-on code 92938, which is for each additional branch subtended by the bypass graft. Then 92941 for percutaneous transluminal revascularization of acute total or subtotal occlusion during acute myocardial infarction and coronary artery or coronary artery bypass graft. Then you have 92943 for percutaneous transluminal revascularization of chronic total occlusion. Read all these terms and highlight. Then 92944 for each additional coronary artery branch. While coding for these procedures, you have to check the main procedure done. Then you have to add the add-on code if there is each additional coronary artery, and also keep in mind that you have to look at all these parenthetical notes under the code. Now let us solve a question related to this procedure. Read the question. The physician performs angioplasty in the left anterior descending coronary and right coronary arteries. What CPT code should you use to report these services? Check the code in option A 92920, which is for percutaneous transluminal coronary angioplasty, single major coronary artery or branch. So 92920 is the right code because they have performed angioplasty in the question. But here they have mentioned two major coronary arteries, that is left anterior descending and right coronary arteries. So you have to mention the code with modifier for each artery. Okay, you cannot directly multiply 92920 3 times. This is wrong. So we'll eliminate option A. Coming to option B, 92920, they have mentioned with 92928, which is for placement of intracoronary stent. But in the scenario, they have not performed placement of stent. So directly eliminate option B. Coming to option C, 92920, which is for percutaneous transluminal coronary angioplasty, single major coronary artery or branch. They have mentioned LD. So the modifier LD is for left anterior descending. That is right. Then 92920, that is for coronary angioplasty, and they have mentioned RC modifier, which is for right coronary. So option C is the right answer. Option D, they have mentioned 92924, which is for percutaneous transluminal coronary arthrectomy. But in the scenario anywhere they have not performed arthrectomy. So we'll eliminate option D. Option C is the right answer. 92920 LD, which is for percutaneous transluminal coronary angioplasty, left anterior descending coronary, and 92920 RC for angioplasty performed on right coronary artery. I hope you are clear with it. Next question. Read the question. A 37-year-old patient with coronary artery occlusive disease arrives to the angiography suite for percutaneous coronary intervention. She will undergo stent placement. I will highlight the term stent placement on both left circumflex, left anterior descending coronary arteries. Percutaneous balloon angioplasty is performed on the right coronary artery. What are the procedure codes for this encounter? Now you can see many codes in the options, right? So first let us check the first code from each option. So you have the code 92924, 92928, again in option C 92924, in option D 92928. So let us check these two codes, 92924 and 92928. 92924 is for percutaneous transluminal coronary arthrectomy with coronary angioplasty. Now check in the scenario if they have performed coronary arthrectomy. No, right. We cannot find coronary arthrectomy in this scenario. So we cannot code 92924. We'll eliminate the option which contains 92924. So option A is eliminated and option C is eliminated. Now we are left with option B and option D. Check the code 92928. That is for percutaneous transcatheter placement of intracoronary stent. So in the scenario they have performed stent placement on both arteries, that is left circumflex and left anterior descending artery. So 92928 is the right code. We'll check the modifiers later. In option B again they have mentioned 92928. So check the second code in option D 92929, which is for each additional branch of a major coronary artery. But in the scenario you can't find any additional branches, right? There are only two arteries, that is left circumflex and left anterior descending. Left circumflex LC and left anterior descending, which is LD. They have not mentioned additional branches, so we cannot use the add-on code 92929. Okay, so we'll eliminate option D. If one code is wrong, the entire option will be wrong. We are left with option B, which is the right answer. 92928 is for placement of intracoronary stent. In the scenario, you can see stent placement on left anterior descending. So they have mentioned the modifier LD. Then again 92928 with modifier LC, which is for stent placement on left circumflex. So we coded these two codes for the stent placement on both the arteries, LD and LC. Now let us check the code 92920. That is for percutaneous transluminal coronary angioplasty, single major coronary artery or branch. So here in the scenario, they have mentioned percutaneous balloon angioplasty is performed on the right coronary artery. So here they have mentioned 92920 with modifier RC, which is for right coronary artery. So the right answer is option B. So they have performed stent placement on two arteries, that is left circumflex and left anterior descending, and they have performed percutaneous balloon angioplasty on right coronary artery, that is RC. Now let us study another important topic in medicine, that is cardiac catheterization. Cardiac catheterization is a diagnostic medical procedure which includes introduction, positioning, repositioning when necessary of the catheter within the vascular system, recording of intracardiac or intravascular pressure, and final evaluation and report of the procedure. Let us look at the codes. Open your CPT book, page number 796. 93451 is for right heart catheterization, including measurement of oxygen saturation and cardiac output. So this is for right heart catheterization. Check the code 93452. This is for left heart catheterization. So highlight the important terms. Also highlight do not report 93452 in conjunction with all these codes. Then check the code 93453, which is for combined right and left heart catheterization. So this is the combination code. If they have mentioned right and left heart catheterization, then instead of coding separately, you can use the combination code. Next, check the code 93454, which is for catheter placement in coronary artery for coronary angiography. 93455, which is for catheter placement in bypass grafts. 93455 includes catheter placement for coronary angiography with bypass graft. Next, check the code 93456, which is for right heart catheterization, that is coronary angiography with right heart catheterization. Then 93457, which is for catheter placement in bypass graft, including intraprocedural injection for bypass graft angiography and right heart catheterization. So it is for coronary angiography with bypass graft, that is with right heart catheterization. 93458, which is for left heart catheterization, that is coronary angiography with left heart catheterization. Always check the parent code while coding indented code. Next, 93459, which is for left heart catheterization with bypass graft angiography. Then 93460, that is with right and left heart catheterization for left ventriculography when performed. So highlight all this, right and left heart catheterization. Then you have the code 93461, which is for right and left heart catheterization for left ventriculography with bypass graft angiography. And always pay attention to the parenthetical notes below the code. Read the question. A cardiac clinic performs several cardiac catheterization procedures. Which of the following code would be correct to report a right heart catheterization and cardiac output? Check option A, 93451. 93451 is for right heart catheterization, including measurement of oxygen saturation and cardiac output when performed. So in the scenario also there is right heart catheterization with measurement of oxygen saturation and cardiac output. So it is matching with the question. We'll keep this option for now. Check option B, 93454, which is for catheter placement of coronary artery for coronary angiography. Check in the scenario if they have performed coronary angiography. No, right? So we cannot code 93454. We'll eliminate option B. Coming to option C, 93503. 93503 is for insertion and placement of flow-directed catheter, example Swan-Ganz, for monitoring purposes. So in the question, we cannot see insertion and placement of flow-directed catheter, right? They have only performed right heart catheterization. So eliminate option C. Coming to option D, 93451, we checked in option A. Check the code 93456. 93456 is for catheter placement in coronary artery for coronary angiography with right heart catheterization. In the scenario, they have not performed coronary angiography. So, we'll eliminate option D. We are left with option A, which is the right answer. The next important topic in medicine section is hydration. It is present in your CPT book, page number 856. So what is hydration? Hydration is defined as the replacement of necessary fluids via an IV infusion, which consists of pre-packaged fluids and electrolytes. Now let us check the CPT codes for hydration services, that is 96360 and 96361. The code 96360 is used for initial 31 minutes to 1 hour and 96361 is used for each additional hour. So you have to use 96361 in conjunction with 96360. IV fluids reported for hydration lasting 30 minutes or less is not reported using infusion codes. It means that we should not use intravenous infusion for hydration of 30 minutes or less. In other words, a minimum time duration of 31 minutes of hydration infusion is required to report these services. Check the code 96360 intravenous infusion hydration initial 31 minutes to 1 hour. And they have mentioned do not report intravenous infusion for hydration of 30 minutes or less. So if the time is 30 minutes or less than 30 minutes, we should not report these services. A minimum time duration of 31 minutes is required to report these services. And we have the add-on code 96361, which is for each additional hour. Here there is an important parenthetical note that report 96361 for hydration infusion intervals of greater than 30 minutes beyond 1 hour increments. It means that 96361 should be used if there is hydration infusion intervals of greater than 30 minutes beyond the 1 hour increments. Let us solve a question related to hydration infusion. Before that, don't forget to show your support to my channel by liking, sharing and subscribing to CodeMed Mastery. Read the question. A cancer patient is coming to have chemotherapy infusion. The physician notes the patient is dehydrated and will first administer a hydration infusion. The infusion time was 1 hour and 30 minutes. Select the code that should be reported for this encounter. So here the time mentioned is 1 hour 30 minutes, which will be 90 minutes in total. In the scenario, they are performing hydration infusion. So we have to use the hydration infusion codes, that is 96360 and 96361 depending on time. In option C, they have mentioned 96365. In option D, 96422. 96365 is for intravenous infusion for therapy, prophylaxis or diagnosis. But according to the scenario, we have to code for hydration. So we cannot use the code 96365. So eliminate option C. And option D, they have mentioned 96422, which is for chemotherapy administration infusion technique up to 1 hour. We cannot use that code also because we have to code exclusively for hydration. So we'll eliminate option D. We are left with option A and option B. We have to code according to the time. So here the time is 90 minutes. So for the initial 31 minutes to 1 hour, you will use the code 96360. Okay, then you have 30 minutes left, right? In option B, they have mentioned 96361. But remember that we have only extra 30 minutes left. If you want to report 96361, you should have infusion intervals greater than 30 minutes beyond 1 hour increment. So after 1 hour, we have only 30 minutes. Okay, so we cannot use the code 96361. In other words, to use the code 96361, the extra time should have been at least 31 minutes. But we have only 30 minutes extra. So for 30 minutes, we should not use the code 96361. At least it should be greater than 30 minutes. So our right answer is option A. We'll only use 96360. I'll eliminate option B. Sally suffered from dehydration after running a marathon. She was taken into her primary care doctor's office. Dr. Small checked Sally and ordered hydration therapy with normal saline. The hydration lasts for 45 minutes. How would you report this service? So in the scenario, hydration is performed. So we should use the code from the range 96360 to 96361 based on time. In option A, they have mentioned 96365, which is for intravenous infusion for therapy, prophylaxis or diagnosis. We cannot use that code, we'll eliminate it. Then they have mentioned in option B 96369, which is for subcutaneous infusion therapy or prophylaxis initial up to 1 hour. So we cannot use that code also, we'll eliminate option B. Coming to option C 96360, which is for intravenous infusion hydration initial 31 minutes to 1 hour. So we'll use the code 96360. So here the time is 45 minutes. So we'll use the code 96360. We'll eliminate option D because they have mentioned 96361. To be more clear, the time is 45 minutes, right? So for the initial 31 minutes to 1 hour, we'll use the code 96360. So option C is the right answer. So that's it for today. In the next video, we'll solve practice questions related to medicine chapter, which will be helpful for your CPC exam. So stay tuned.